Okay, so officially welcome now everybody to this roundtable discussion on the crisis in India. And yeah, so before we start, I again, for the record, so to speak, I would like to give you a kind of overview what we are going to discuss today. So we have 5 different sections. The first one is maybe short. It is just, I will ask everybody around today whether India is a surprise or whether, or whether somebody has actually expected this kind of crisis in India. For example, based on other information, I'm particularly thinking about Brazil in this case. Then in B, we will discuss mutations and evolutionary biology of the coronavirus. We already had a very nice pre-discussion about that, but we will come to that point in a moment. In the next section, C, we will discuss behavior. What is different in different countries? What is different, especially maybe in India? A lot, of course, plays into behavior. For example, different sociological factors that might be different in different countries. Then in D, I would like to discuss a kind of risk analysis or factor analysis. So how do the different ideas we have about pandemic outbreak in India, how do they fit together? How do they mutually maybe cancel each other? How do they mutually enhance each other? That is, of course, the more severe case. And then in E, I would like to go to lessons for the future. So we have just quite a program announced. So let's be quick and start with it. So I would like to start the discussion by reminding everybody on the time course of the COVID-19 pandemic. I think it's very nice to travel back in time for a moment and see how different countries have been affected by this at different times. So thanks to Steffen Bauer, he prepared this world map for us. And let's run it. So it starts, as you can see, in January 2020. And there's not much happening at the moment. So now we have March. Yeah, and now you see the typical pattern here. Now in March 2020, the pandemic is discovered in Europe, especially in Italy, as you can see. And maybe you, especially the Europeans among us, remember all these scenes from Italian hospitals, especially in northern Italy, which are now sadly repeated in India. So now other countries pick it up here at that stage. We are now in April 2020. You see that US is massively becoming problems, having problems. Now the disease, spreads around the world. Here now in, what do we have? We have now May 2020. You see that for the first time, there is a massive outbreak in South America. Actually, not mostly in Brazil, but Peru at the time was very hard hit. Now you see that also other countries, Russia, here the Middle East is affected. And here you can see that Brazil is now becoming a hotspot slowly. Now, also Africa for the first time is affected. And of course, here South Africa is the country most affected. Yeah, that is now July 2020. You can see that the US is having massive problems. In the summer 2020, so last summer, Europe was having a relatively good time. You can see that from the green here. But the US really had a problem. And also you can see here, South Africa had a problem. I should also say at that time, so July 2020, India nearly had no problems at all. And I was going through the data and reports all the time. And the explanation I heard for India at the time was, yes, the virus is around, but India has a relatively young population. So yeah, it's relatively, because we know the virus is more virulent in older people. So India is lucky because it has a young, in general, a young population. Now let's continue. Now India is picking up, but nothing compared to the US. And at that stage here in September 2020, you see that South Africa is the hotspot, besides, of course, North America. And in Europe, it was strange because especially France and Spain had massive problems at the time. And then you will see that in Europe, Britain is becoming heavily infected. We might be able to discuss that with respect to oops, sorry, we will have to discuss that with respect to the policies in Europe. So let's continue. Yeah, Canada is picking up now in winter. But as you can see, I mean, focus your view to India. India has no problems at all. For example, compared to Persia, which is very close by, it has really no problems. And that is surprising. Of course, only surprising as long as we believe the data. We have maybe to discuss that as well. Europe is still crippled by the pandemic. South America is becoming a little bit better, but you can also see that South America has, for a very long time, nearly a constant hotspot quality. Also the US, as has Europe. But now, here you can see it, India, now that is April 2021 is now picking up. And now it should pick up drastically in the end. So I let it run to the end until the present time. So this is the situation now. Yeah, you can see that India is, of course, in the same color as, for example, Brazil. But we know that in India, the health system is overwhelmed and it has maybe more severe consequences, but maybe not. I would like to ask the respective people who know that better. But as you can see, Europe now is, of course, also still having problems. But on the other hand, we have the rollout of the vaccination program. This is also maybe something we should have in mind. Also, especially in Britain and in the US, also, of course, in Israel, but Israel is a small country. We have by now relatively successful vaccination strategies. So yeah, I would like to stop the screen sharing now. So after this little recapture of the COVID-19 dynamics worldwide, I would like to go to our first questions. So is actually now in comparison, also with comparison to the data, do you think India is a surprise? So I think India is a surprise, but I'm biased because I was believing this hypothesis that India is less affected because of the age structure of the population. However, if you look at the newest hospital data worldwide, not only in India, you can see that younger and younger people are infected. This, of course, might be a hint that also the virus has already changed, which we will discuss in the next section. So
maybe the devil's advocate and say, I'm not too surprised because India had a very vigorous lockdown last year, which was unpopular, but that did slow things down. Then it's certainly clear that COVID had not disappeared from India. But when you start having mass meetings of people, political rallies, and various other mass groupings, that would trigger something that happens very quickly. So I think that was a very dangerous thing to do. The other thing from your map that makes me extremely nervous is the only big green area remaining on the map is Africa, Central Africa. And how much of what we saw in India was an epiphenomenon having a significant proportion of people in a few big cities, but lots of rural populations where everything works much more slowly, where Africa is the next stage along that spectrum, where you've got a similar number on the whole continent of large cities or less than you have in India, but a massive rural population where everything is moving very, very slowly. And you know, I would desperately start vaccinating people in Africa as soon as possible.
Well, the question is, will we be able to do that? But maybe we also delay that kind of discussion. So anybody else not surprised about India?
I would like to comment. I'm a bit surprised because I expected India to have learned from what has happened in other parts of the world, like experience in the way of Bayesian thinking, so that you take action based on what has happened. But it really has surprised me that it has taken this toll. I thought they could have made interventions to actually protect themselves from such a huge impact. But in that way, it is surprising to me.
Yeah, that is a good point. But what
it's not surprising. It's not surprising to me because in India we know anything happens, it happens in huge numbers. You know, even a cyclone comes or even wind comes, people die. You know, even people die. So numbers are always. I was actually surprised why the numbers were low the first phase. You know, because in India it should have been huge because people were not wearing masks, protections were not there. The lockdown had a limited effect. So I couldn't understand why we didn't have this thing. So now for me, and then, you know, election rallies and people who are going to weddings and people practically ignored at a mass level this thing, because the political behavior of the politicians and everyone gave the impression that only few people will get it, or older people get it, or you know, there is something called, oh, we have immunity, or even Indians believe that their food habits are so good that they won't get it. There are a lot of belief systems which are there, but I think they were not scientifically verified. So I'm not surprised.
Yeah. Somebody else not being surprised?
Yeah, I'm Bhatnagar from India.
Yeah.
And I was actually also not surprised because 100 years back, there was Spanish flu in which India was also affected, and there were 4 waves, and it lasted for 2 years. And at that time, World War was just ending. So at that time also, governments and states or countries which were well prepared after the first wave were hit less, and those which were not prepared were caught by surprise. So I'm not surprised at all because an epidemic does not end by just one wave. It 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 occurs in a few waves, and given the fact that in 100 years, or rather 102 years, we have grown up about 5 times in world population, also gone many times in terms of density, also in terms of pollutions and climate change, as well as the amount and the kind of comorbidities that exist in the Indian population, as well as elsewhere, of course, cancer, diabetes, hypertension, and all those things is something that we should have, I mean, everyone should have planned for. Even the Western world, Western developed economies should have planned, because their hospitals, which they boast of being so well developed and so well equipped, and a very high ratio of ICU beds to per 100,000 of population, it crumbled, because this kind of things they should have learned from Spanish flu itself, and pandemics have been occurring in the human history ever since. So it is not something very new. So they should have learned it, and even in the developed countries, public health system should have been very strong.
Can I just ask you one specific item? You don't think our technology, I mean, especially the vaccination, the vaccines being developed, that was relatively quick. So somehow our knowledge to fight pandemics has also increased since the Spanish flu. So, but you don't think that is a major factor?
I think vaccine has been developed, but as of today, only about 15 to 20% of the Indian population has been vaccinated, whereas for herd immunity to develop, you need at least 65 to 70% population to be developed, and to wait for things to take their own course will take a very heavy human casualties, because by the time you have herd immunity, you will have massive casualties. So and that will crumble, that will affect not only population but also the economy, out of which it will be very difficult to recover, because this is a global economy. If one part of the economy in the world is affected, the other part is also affected.
That is a very good point, because also mobility has increased massively.
Mobility also in the last 100 years, since Spanish flu, mobility has gone up many times.
Yeah, that's true. Yeah, that's a good
point. So that is also a factor. So mutants have a more chance to grow. You have vaccines, but at the same time, complexities too have grown up. So unless and until you outpace in terms of technology or to the level of complexity, your technological sophistication is more and the complexities are less, then only you will be able to win. Otherwise, the disease will win. This is what I believe at this point.
Thank you very much.
I was not very surprised at the rate India has developed the second wave or is witnessing the second wave. And I think primarily one of the reasons is that the numbers are not registered. I mean, the official numbers that we are seeing, we have to realize that in India, it doesn't work like that. There are people who are not registered in government IDs or in government official data. So so even the numbers that we think are alarming, they are not enough. It has to be seen and it has to be understood that the actual numbers are manifold. They are multiplied by what we are witnessing at this moment. And second thing I said, which Mr. Bhatnagar already pointed out, the strain on the healthcare. I don't, Europe and elsewhere in the world, I don't know a lot about the southern countries of the world, but especially India, the WHO doctor to patient ratio is recommended is 1 to 1,000, but the average patient's doctor is catering in India ranges from 1,600 to 2,000. So and then further on, there are smaller healthcare centers, and then there are major hospitals. So the strain is mostly seen in major hospitals, where we are seeing they're running out of oxygens and all of that things, because people don't believe because people believe that the hierarchy and everybody at the top of hierarchy gets the best medicines. So the smaller healthcare centers and everything that is around the rural areas particularly, people don't trust them, and rightly so, because most of them haven't even gotten the first dosage of vaccines, and the vaccines have been developed it's been 4 or 5 months now. India has been making vaccines for the rest of the world. Out of every 6 vaccines that the UK has received, 1 is being made in India. So it does have enough vaccines to export, but not for its people, not for the people in the rural areas and in the urban areas.
But wasn't that really a mistake by the Indian government? I mean, you know, they exported the vaccines, but did not really.
I mean, a lot of these things can be blamed on the Indian government. One of them is the exported vaccines. And if they knew that they are exporting vaccines and later on they're not receiving the raw materials from the US to make the vaccines, they still went on to hold elections, to hold rallies. One of the high courts in one of the states is actually holding the election commission responsible for the outrage of the outrage of the virus, the second wave. But I don't think the important point to notice is even if we do roll out vaccines at a larger stage and even if we develop herd immunity, Turkey is seeing the third phase of the virus. It is a part of Europe. It tackled with the virus before. It's seeing a third phase. And so even if somehow, I don't know how, but if somehow India does overcome the second wave, there is going to be a third one, which again might be worse than this.
Yeah.
I have something to add.
Yeah.
Yeah. So if we talk about how surprised we are in terms of virus, the pace of virus as it has been spreading. So see, there was always a warning signs. So if you look at the federal dimension of India's composition, so there are states which were struggling from the very first month of March 2020 when the pandemic started. So some states like if you talk about Maharashtra, where Mumbai is located, so that state has suffered from the very beginning, and the like pace of virus being spread in the society, or what we call community spread, the certain symbols were there that there's a community spread within that part of the country. So while some other parts of the country were living life as like the casual way, their usual way. So if we see in the parts or the at the level of states, some states have been taken by surprise with the current pace of the virus, because they never expected that the spread would be like, if I talk about Delhi, because I'm sitting in Delhi. So I remember on 4th of April I was outside, I was meeting some people and I was seeing large gatherings, and today it's 29th April and we can't go out for last 14 days. So
I think
that,
you are absolutely right with your analysis. I mean, I looked at the data, and you know, the increase in incidence in India is really very surprising, because you know, some factors have to come together in order to explain that, because that's very unique. Not even in the US or some other countries where the virus was spreading freely, let's say, there was not such rates
there is
measured.
a genome study which says that 50% of the current cases in this second wave have been like it has occurred due to the UK strain in India. It has been published in Economic Times. I can share the link if you want later. So maybe due to the mutation of the virus, the spreading has increased, like the pace of the spread of the virus has increased, and that has taken some of the states by surprise, including Delhi, and now we are seeing like the surrounding states within Delhi, around Delhi, are also seeing a huge impact of the virus load and cases increasing in every day counting.
Yeah. Well, thank you for that. So does somebody like to contribute to this first round, or should we now go to the second round of questions about mutations and evolutionary biology?
Marcus,
Yeah.
I had just one question related to the general picture from India. Well, I know that India is a huge country, is almost a continent, and and there is this structure in states, right? So I was wondering whether there is there is a uniform spreading, or instead there are states which are more affected and states which are slightly more safe. And if it's so, if there is this no homogeneity, then there should be some correlation, some factors.
That would be an interesting analysis. I don't know the numbers. I mean, we have just heard
from
that.
press who want to see them. It's from Covid-19 joint group that analyzes this.
Yeah, can you share it if you?
Yeah, just give me 1 second to
So
find
there are
it.
states.
There is a
Yeah.
variation. So
I will share it.
Well, I just always say what I know about India is that Kerala was always doing well. But, okay, you have them.
Oh, so you have it. Great.
I think what you have said, sorry, I forgot your name. It's really the state of Maharashtra. This is the cumulative numbers of cases, but it shows that really one state really is.
But for instance,
yeah.
On that one,
but there are many which is very low, which are very low, by the way.
Yeah.
Right.
But you see here.
I would actually like to, I don't know, refute the data. Can you point it back to the state ones that you were holding up? Yeah. So I am from Jammu and Kashmir, and as you can see, the line is almost flattened. So very few cases on chart, right? But then, so the intra-travel in India from state to state has been active ever since the lockdown was lifted. And there are factors you have to see that there are migrant laborers, students, people living from different places, going to different places to visit their family, to their parents or whoever, especially the state that I come from. And we are just beginning to witness, Jammu and Kashmir, I'm pointing out, we are just beginning to witness the rise in the numbers. And the primary cause for that is the tourism. So Jammu and Kashmir is known, especially the Kashmir region, the valley is known for its tourism and all its fun, beautiful places. And recently we have had people from Maharashtra, Calcutta, West Bengal, and New Delhi. These three states, majorly coming from these three states, and the rise that we are seeing is attributed to the people coming from those states. But beyond that, there is another factor that is going on, which I think we can attribute to the cases that we are seeing on screen, which is that the rapid tests, the rapid antigen tests, and the RCPC and the RCT-PCR tests that are being done to know whether a person has the virus or not, are actually 30% of the results have been false. So you'd have to go in every 3 days or every week to get yourself tested again to know whether you have the virus. And most of the cases, some of the cases are asymptomatic and they do test positive. Some of the cases they have all the symptoms, but then they're not testing positive. So even the testing has to be has to be considered in the rises. And I'd say it's just going to rise in the states that we are seeing a flattened curve in.
Actually, can you comment on PCR tests? Is there a little, I mean, how good is the testing for mutations? Because we will now come to mutations in India. You know, how good is the picture about tracking mutations in India? I guess it's not as good as
it's not as good as it looks from the outside. Most of the tests, as I just stated, and then there is also a report by the Australian, if you look at it. A report recently published in the Australian stated that the people who just came from India to Australia, all of them are in quarantine and they are testing positive. While as in India, while they were boarded after the flight, they all tested negative. So most of them, maybe it was one flight or what, I don't know which flight or what the numbers were. But then this is the case. And the RCT-PCR tests that are being done, initially it was said that they cannot detect the UK variant.
Yeah.
So, and as I think it was somebody just pointed out that 50% of the cases that have risen in India are because of the UK variant.
Okay, yeah. So I think we should now proceed to our second section, and that is exactly about mutations and evolutionary biology. I actually would like to ask Andy to make an introduction to that. So, we were just discussing before the recording, how likely is it actually that certain mutations come about? I think mutations are also interesting because that shifts our discussion from a local Indian level to a global level, in the sense that, all the world is now worried that in certain countries, especially, countries with a large population, there is high incidence of the virus, and therefore the likeliness of a mutation being created is becoming higher. So what is the evolutionary background for such hypotheses? Maybe Andy can explain us this very quickly in some words.
Okay, I mean, I will try and be as quick and just lay out what I would think would be the most parsimonious way of thinking about this. One, all viruses mutate, and the mutation rate is roughly constant per base pair, or base, because it's not pairs, because it's an RNA single-strand virus. The curious thing about COVID is it's a monster virus. It's really, really huge compared to something like influenza or measles, which would be, influenza would be a Drosophila, measles would be a mouse, COVID is a blue whale. It's a huge thing. And that means it's so big that it's actually got self-correcting mechanisms. So although it mutates, it's actually got correction mechanisms, which makes it completely different from influenza, which is like one of the smallest ones. So influenza mutates all the time, but it has to mutate all the time because it generates immunity that the new strains have to be able to get around. And that's an important point, because there are essentially two extremes that determine whether a mutation takes off or not. If a virus has been introduced in a new population, the number of mutations that will take off in new strains will, I think, pretty linearly be a function of the number of people that are infected, because it's the same process going on in all of them, though there will be some change depending on whether those people contact people at a very early stage, before virulence is expressed, or at a later stage when virulence is being expressed, when you would have different mutations appearing. That means that you will get essentially selection for more transmissible mutants that we're seeing at the moment. Lots of new strains that are more transmissible. There will be an equal number of strains for mutations for strains that are less transmissible, but those will just disappear, because if you're not as competitive as the other strains out there, you're going to disappear. The second thing that happens that we haven't really, not anybody's talking about yet, is that selection changes once herd immunity arises, because the virus, instead of only finding hosts that are susceptible, starts finding hosts that are resistant, and there's selection for the virus to whatever mutations there are that can get around that immunity. And that's what we see with influenza. That's why we have to have new influenza vaccines every 2 years or so, because the influenza's pretty much gone through everybody who's susceptible and generated massive levels of herd immunity, which the mutations then have to get round. So the good news about COVID is it's so big, its self-correcting mechanisms will slow down the rate of those new mutations.
Can I ask you one question about that? I mean, I agree that the self-correction, of course, makes it like a little organism. And so that's good for us, because mutations are not as likely. But on the other hand, as you rightly pointed out, the virus is very, very big. You compared it to a blue whale. So that gives also more possibilities for different mutations. And exactly. What would you think, which one of the two is the stronger argument?
Well, I think having the correction mechanisms is actually a powerful way of slowing down what you're changing. It means that most of the mutations you're seeing will be functional ones, because then they will not try and correct those. So it's a double-edged sword. Yes, it's got that, but anything that appears, so maybe it changes that that balance, when I said 50% more transmissible, 50% less transmissible, those will quickly be selected out, even possibly by the virus itself. So most of the things we see will be more transmissible. Once, as I say, you start have the virus circulating in a population with high levels of immunity, are you then going to get some form of selection that says, let's look at strains that can get around that immunity and reuse a host that's already immune? Then we start selecting for that. So the game is going to change once herd immunity levels get up by vaccination or natural infection. So that would be my next worry. The third thing, which is a sort of little achieved thing, that just stuff I've been working on in the background, if you look at the relationship between duration of immunity and size of a virus, it's a beautiful -3/4 scaling law.
Oh, well, that's interesting.
Immunity to measles is at the peak of that. So you have lifelong immunity to measles. Influenza is so small that it keeps mutating. So you've got lifelong immunity to whatever influenza you've had before, but it's become something else. COVID is very big. So I don't think immunity is going to last very long. Which means we're going to have to vaccinate everybody all the time, or you're going to have some balance between the people who were vaccinated get topped up by the people who weren't vaccinated.
Yeah, that's a very good point. And now let's go to the mixing hypothesis. Would you agree that countries in which different strains actually coexist at the moment, that they are also more likely to create something new, because these are already variants that have proven to be persistent, and these are viable mutations, and now their combinations are maybe also more likely to be viable.
Yeah, I get, well, I mean, the simplest way to do that calculation is to say what proportion of the people are infected at any one time, because then the proportion of people that are co-infected will be that squared. So if you've got 1% of people infected at any one time, then 0.001 of them are actually likely to be co-infected. So that's a sort of relatively low probability until you have huge numbers of people infected, and then it becomes a bigger worry.
Yeah. So I think that was a very nice introduction into the problems we encounter. Now let's maybe go through the world and see what kind of mutations we have and where they are spreading. So let me maybe start with Europe. I think here in Europe, the first concern was in England, the so-called Kent variant that might have occurred in the south of England. But of course, we never know where something has really been created. It might also, of course, have come from somewhere else. Does somebody know about the situation in South America?
Hi, this is Ronald. I'm from Brazil, São Paulo. I'm still here. The weird thing about the Brazilian variation, of course, maybe around the scientific community is being well reported, but the public, it's hardly ever spoken about in financial press and even the broadsheets, the serious media. It's not, nobody's mentioning it. And even like what percentage of people who are getting infected have the variant? It's kind of quiet, right? So that's not good, of course, right? Because it's bad information. But I would have to say, and I warned you, I'm going to speculate because I don't like to know the facts. Of course, the younger people are getting it now, so so that certainly looks as if that is definitely a side effect of the new variant, and of course that's probably what's driving the numbers up, unfortunately.
So you believe the mutations have increased infectivity and are driving for example, this second wave we observed in Manaus, which was very badly hit in the first wave already in Brazil. So you think people have lost immunity to this first virus, to the first variant of the coronavirus, and now got reinfected by the Brazilian mutation variation?
I think that's still open to debate, to be honest. If I mean, it seems that seems to be so. That I know a lot of people in Manaus, and they've said they know a lot of people being reinfected again. But that's really not that scientific, to be honest. But certainly the younger people getting the virus is fine. Now, you mentioned Manaus, of course, the Amazon. It's a very poorly managed state. I hate to say these things. It is what it is. And give you a number. Just give you a number right now. Right now, let's say São Paulo, which is probably the least worst place. We have vaccines, and we have vaccinated. What we get, 98.54% are being injected in people. Right. So life is good. We get vaccines, we inject it. Right. Rio de Janeiro, 67%. Right. So 33% not being there, and in the Manaus, 58% of what they receive, they vaccinate. I mean, that's poor management. And I have these numbers per state. So, I mean, people want to blame Bolsonaro as the boogeyman, of course. There are a lot of bad players, nobody's really helping too much. But Manaus has their issues in delivering healthcare. So something as simple as applying the vaccines you got, 58% have only been applied to date.
Yeah, that's I think you're absolutely right with that. I mean, we discussed that at a later stage when we discuss how different factors come together to explain something. And so I take your message as saying it is as much bad policy as it is maybe a mutation that causes this kind of severe wave in for example, in Manaus.
Yes, it's a mixture of factors. Yes, and of course, the doctor, our Indian colleague mentioned, of course, number of doctors per person and stuff like that. Yes, and of course, Manaus is one of the largest states, and there are people who really have no access to healthcare. You know, they live in where there are rivers contacts. They're living in very, very far from the city. So it is a complicated place.
Yeah.
But the bad thing, I think, I'm a finance guy point of view, if Brazil is being labeled as having this Brazilian variant, which it is, not saying no, that's going to give problems for like the vaccine passports and vaccine certificates, and we're going to look at a Brazilian passport 10 times. So so that's not good for business, of course.
Yeah, of course. Yeah. Okay, let's now go maybe to Africa. So let's go to South Africa. Is there anything we can say about the occurrence of the South African variants?
Yes, I think currently I think it's the dominant variant because remember South Africa had actually intended to start vaccinating using AstraZeneca, but immediately the team, which was the team of scientists, discovered that AstraZeneca was not efficacious to the variant. So they had to make decisions to change to a new vaccine, Johnson & Johnson and others. So basically, it is when the variant struck, the numbers went up. But I think the control strategies were quite good because as I was traveling just recently to Europe, I think the numbers had gone down quite drastically, about 1,000 per day or something like that, which from 20,000 and more per day. So I think the control strategies in South Africa had done a good job.
What have been the control mechanisms?
It's basically the issues of social distancing, making sure people wear masks and so forth, and avoiding people kind of gathering in large crowds and so forth. I think that has helped quite a lot in one way or the other. So I think now if the vaccines take off nicely, I think it will be quite profitable.
And do you know something about the spread of the South African variant inside Africa? Does it occur in other African countries?
I don't think I don't have data at hand to suggest that it has rapidly spread to other parts of Africa. I think that is something which needs to be investigated. But as far as I'm concerned, it looks like it is more in the southern part of Africa.
Yeah. Okay, I think that should be okay for our mutation section, or does somebody else like to contribute? I think we don't know too much at the moment about the occurrence of mutations in India itself. I mean, there are some data. I saw some data, but I think also given the quality of the data, maybe it's too early to discuss that. So let's go to our very important section now, which is behavior. Because here, of course, I would like to involve our Indian colleagues a lot, because it was really claimed in the media worldwide, that a large culprit, let's say, in the Indian COVID crisis was, of course, for example, the occurrence of mass gatherings, no social distancing. I think in this topic, we also have to discuss coronavirus fatigue. So, I think especially in India, we also have to discuss economic consequences of policy measures, because, some people might just not be able to go into lockdown because of economic reasons. And maybe that might also contribute as a factor to the situation in India. So what are your opinions about how much behavior can be blamed for the current crisis in India? I would like to ask especially our Indian colleagues.
I would certainly blame the behavior, because just now, just 20 minutes back, there was a wedding next to my house.
Mm-hmm.
There's a huge gathering there celebrating, because people believe life has to be lived, probably like, and there's a lot of disbelief about Corona. They think that Corona is a myth, or, it's a false campaign. That's strongly believed by people. Second, people believe that the virus does not touch them or something. Their bodies are somewhere immune. There are doctors saying that Indian food will protect them. Indian spicy food will protect them, because we eat good spices, so we are immune for this virus. So there are these arguments given by doctors on TV, on YouTube.
So you think it's even an education problem?
It's an also education problem.
Mm.
One basic thing at present now is people thought that if you could maintain 6 feet distance, that was enough. But the new information is saying it is more airborne. That means it can travel much longer distance than this. So even one person comes into the room and goes out, the virus still exists. So people did not know this. So our department faculties have died last week, because she used to wear the mask, but when the person leaves, she used to remove it for, for breathing. So then there is this religious sentiment. There are people who say that if you believe in God truly, you won't get the virus. So there is that thing. There are people in that Mela, you must have heard that if you have bath in the river, you will be cleansed of these things. So there are these belief systems so there is science skepticism and number skepticism. So there is this two skepticisms and these are partly introduced by so-called doctors on TV and YouTube, on Facebook. So there are a lot of doctors who initially said masks won't work. So there's confusion of information about, probably even to the politicians, they gave this information. The doctors themselves are not giving clear information to the politicians. The politician is relying on some doctor, and the doctor says, go ahead, so they go off,
And
That's my view.
And do you think when you walk in the streets, could you see that people behave such that they do not acknowledge the existence of the coronavirus?
Yeah, even today, as of today, there are a lot of people who don't acknowledge the existence of coronavirus. Yes. As of now, there are to convince people. People are attending funerals of their relatives because it's part of the religion, it's part of the culture. So but they're getting contaminated there. They're getting infected there. Yeah.
Yeah, it's very interesting. Do the other Indian colleagues agree with all of that, or would like to add something to these observations?
So I have something to add. So see, you have to see things in a broader perspective. First, uh, this should be like the population of India should be considered a blessing in disguise. So anyway, any system cannot control 1 billion population in any through any measures. So that is one thing we should consider as a fact. Though at the local level, you may find several mechanisms, several institutions which do have performed well in controlling the behavior of the population. But in general perspective, in overall behavioral pattern, if we see throughout the country, uh, the training or the awareness with regard to virus is not there. So even though people are uneducated, if some politician, some spiritual leader speaks out to them and tells them that this is the thing you have to do, so they usually follow. So though there's a population of 1 billion, if there could have been a strict messaging from the ruling class or from the spiritual leaders, things could have been different, but that was not there. Their own behavior was quite you can say misinformed or not as per the requirement of the COVID virus. Second thing, see, this is a countrywide not problem, but there are lots of misconception when it comes to healthcare facilities. So in India, I was also discussing with Krishna sir in the afternoon that people usually don't rely on the hospitals to treat themselves. From many past years, if you see, there's a hesitancy to reach out to the hospital or to the doctors who have come from the educational background or who have trained as professionals doctor. So they usually don't go to them as a first course of treatment. They rely on their own traditional method, what we call here allopathy. Sorry, homeopathy. Homeopathy.
Yeah.
So this was a broad understanding in the first wave when this virus started that Indians are immune or we can immune ourselves by practicing certain homeopathic medicines or homeopathic practices at our home.
Yeah. So modern medicine is in competition with more traditional health approaches, I guess.
First, it's about belief. So people largely believe that their homeopathic medicines are far better than the allopathic medicine. Second, it's about the reach, because allopathic system of treatment is costly in India, and there's no overall countrywide insurance like scheme which is null. So people who have to pay out of their pocket or to get for the OPD treatment, they hesitate to visit the hospital, and primarily they visit the government hospitals only, and that too is very limited number of people. So this is not only towards the virus, in general towards the health system or health practices. Indian population is quite uh, has always been divided in terms of accessing the healthcare in modern sense. So that is one of the factors which leads or which has led to people to the like a general perception or nonsensical perception that we are immune to the COVID virus, and even if it happens to us, we can get treated at our own home by eating something or by taking some sorts of traditional spices and other things.
Well, but maybe, people were encouraged to think so because, as we saw in the beginning, in the introduction, India was not affected too much by COVID-19 relative to other parts of the world. But my question would be, now that you see so many incidents and that you see in the media all the time, that people are dying in the hospital and so on, how good is India in transmitting this message and changing behavior?
I would like to speak on that and also add a point to what Vikas says subsequently by saying this. So the behavior factor that Krishna sir also pointed out, that there was a wedding and people. So most of the people are of this belief, that they happen to survive the first wave of the virus, they won't get it anymore, and they have the immunity. And the people, and it doesn't really stop there. People are skeptical of the vaccines because they don't, and as Vikas rightly pointed out, they don't trust they don't really trust scientific methods and scientific methodologies of medicines and all of that. But also one of the other things that is there, and he rightly said that it is the access to healthcare is very rigid in India, and it's not accessible to all. It's not really uniform. And as you said, how good is the message spreading on that? Now, there are two things to it. A large population of, I keep speaking, I pointed this out before this as well, the migrant population or the labor working class population. On an average, if the labor has hard work, if the labor has hard work given, so on an average, the labor would earn around 500 rupees, 500 Indian rupees. And the cost of getting a vaccination, which has now been privatized, ranges from 600 to 1200 rupees. So an oxygen cylinder would cost you around 10,000 rupees. And the medicine, remdesivir, would normally in market cost around 5,000 to 7,000. But in black, that ranges from 50,000 to 70,000. And there is a laborer whose daily wage, if earned, a very big if earned, is 500 rupees. So even if the laborer would want to is taking all the precautions, understanding what has been told, and because I think the lower class, the lower class does understand that they do not have an access to healthcare, and they are dependent on themselves to protect themselves. So even if they wanted to take all these precautions and they know the things, I don't think they have the monetary I don't think they have the monetary push to do that for themselves. So a part of behaviorism is that, and B, I think the government has a very big role in actually propagating this sense of immunity, the sense of immunity from the vaccines. They have been holding rallies for the past 2 months, and there was a Kumbh Mela, and it has been attended by lakhs of people, tens and thousands of people. And it is majorly being led by the people in the government, in the central government. So if the government is rolling out these kinds of things, the people ought to believe it. Well, if they aren't getting it, they aren't catching the virus, they are in there with lakhs of people, I might as well go ahead and do it.
Has the government now changed tone because of the crisis, slowly at least? Is there some messaging?
It's very tough to say. The thing that you hear from government, the underlining of all the things that government is saying is that you are on your own. Look out, stay safe, stay at homes.
Yeah, that.
Yeah, what about the oxygen shortages? What about the medicine shortages? What about the vaccines? And as you stated, that Kerala has been doing better than the rest of the states. So Kerala has been asking for vaccine dosages from the government. They asked for 55 lakhs and they were given 5.5 lakh vaccines.
Okay. Yeah.
So there's a huge gap, and I don't know, the tone of the government is basically stay home, stay safe. And of course, that's not possible at this rate anymore. The Lancet report just came in. It's probably airborne. We don't know. So yeah. Also, one of the factors that would attribute to the behavior is the hot climate. I don't think we should factor that out.
Well, there's a lot of speculation about that. I'm not sure, because some people, this is a very tricky mathematical issue, about how you get infected and also how long the virus can survive outside an organism. So, you have to discuss things like radiation, how much radiation do you have that destroys the virus particles. But that also might depend on, we had this discussion with respect to mutation that also might depend on how stable the virus is actually is. I don't know much about the coronavirus, but it seems to be a very special molecule, a very large one. I don't know if that is good or bad in a hot climate, but I have not seen conclusive data whether a hot climate is actually encouraging the coronavirus transmission.
I have something to add with regard to political messaging from the government, which Marcus asked. So when the second wave was being highlighted in the media, in the Indian media, so the government's official position, because everyone was asking that you should stop the elections. The elections were happening, people were in the queue. So it was being requested that you should postpone the election or just conclude them in a single phase. Instead of going for multiple phase, you should conclude the election. So this government knows very well how to manipulate the numbers to serve their own interest. So what they did, they started arguing with the fact that the highest number of cases which were coming in that particular period, like 15 days ago, were from Maharashtra, Delhi, and Kerala. And out of these three states, only one state had the elections. Like Kerala had the elections, Maharashtra and Delhi were not into the elections. So they said that elections are not the reason why numbers are rising. So you should not ask us to stop the elections. And but they forgot the thing that virus takes time to come out in the to be tracked. So now those states are also seeing a rising numbers after 15 days. Like West Bengal, which was reporting around 3,000 5,000 cases 15 days ago, now has started reporting officially 15,000 or 14,000 cases, which is under reporting because
Still
tests
under
are not
report.
tests are not happening, and numbers are not like the never trust the government's official number in India. Always think that there are cases at least twice the number of reported cases. That's the bottom line.
Yeah, I even heard 3 times as much. Somebody said, yeah. So that is definitely something maybe we have not time to discuss today, but you know, the speeds both of trace and testing and also the speed of vaccination rollout are, of course, depending on a functioning healthcare system. And I guess in both respects, India will have severe problems that have to be taken into account. Yeah, okay.
Yeah, I would like to add something to it. Can I add something to it?
Sorry, say it again.
Can I add something to it?
Yeah, of course. Yeah.
Yeah. So one thing is that those people who are out, at least some of them, they build immunity to the situation. That is one thing. Not everyone, but at least some of them, right? So first thing is this. Then the second thing is that Indian government, I am referring to Dr. Rutba's point of the poverty. Of course, there are poor people and healthcare system is very expensive here and I guess elsewhere too, abroad too. So Indian government has a Jan Arogya scheme in which PM Arogya Jan Arogya scheme in which poor people have health coverage up to 500,000 rupees, 5 lakh rupees. And likewise, here also in Maharashtra, I guess at least in some of the other states also, they have a state government healthcare scheme. Like here in Maharashtra, they have Savitribai Phule scheme for the healthcare for the poor people. And in government hospitals, the vaccination is free. I got my vaccination for free in a government hospital. And in private hospital, there is some charge of which the Serum Institute of India, which makes the Oxford AstraZeneca vaccine, has now lowered the cost to about 150 rupees per vaccine, which comes to about £2, I think. By £2, they have per vaccine, they have lowered the dose. And as the large scale for the production increases, I think the vaccine cost will further go down. So I would like to add this note to whatever discussion has been going on. Of course, I do acknowledge that there is some problem.
Yeah, okay. Well,
not some, but lot of problems. Yes.
Yeah, thank you. That's quite interesting.
Okay, can I add something?
Yes, please. Yeah, go ahead.
Yeah, thank you. So I agree with Dr. Bhatnagar that we have to see things in a broader way. Like India is a big country, and with lots of types of people living here. And the problem that I think that we are facing is that still many people are not accepting corona. As my friends already said this, that they are even at this stage that people are dying, and still they are not accepting that that corona is there, and we need vaccination. Even they are saying that don't worry about this, don't go for vaccination, this is nothing, and that is very wrong way. That I have taken first dose of AstraZeneca, but 10 days before I tested positive. I'm still in isolation, but I'm okay. I have mild symptoms. With the God's grace, I'm improving myself. But we have to worry about that. It's a big problem for whole world, and India is facing it on the front, and it's a really tough time for all of us.
Yeah. So what was the time period after the vaccination when you had problems?
After 10 days.
After 10 days, yeah. It's not enough. Yeah. Usually you need 3 weeks after an AstraZeneca shot to reach the full potential of the vaccine.
But with God's grace, I'm okay. Just fever for 10 days, and now I'm recovering. Nothing else.
Yeah, okay. So that is very interesting contribution. Okay, let's continue with our section D.
Can I also ask something? Sorry. It was interesting. Yeah, sorry. It was interesting what people from India said about people not trusting traditional medicine and not trusting hospitals, because something I've read that apparently people from the WHO said was sort of exactly the opposite. That part of the problem with hospitals being overwhelmed in India was because too many people rushed to hospitals who could have been treated at home. So I read this first on a Ukrainian website, and now found the same information in Al Jazeera. So just to quote, some people in India rushing unnecessarily to hospital, exacerbating a crisis of resurging COVID-19 infections caused by mass gatherings, more contagious variants, and low vaccination rates, the World Health Organization said. Apparently this was said by a spokesman of the WHO. So I wonder if people from India can comment on this. It's quite interesting. So does it mean that there are some people who don't trust the medicine enough, and some people who maybe trust it too much, or want to use hospitals too much? What do you think about that?
Does somebody like to comment on this?
Yes, I can. When it comes to a health system, the best approach is an integrated healthcare system, which combines the traditional as well as the modern method. And recently we have set up the Ministry of Ayush, which integrates these various systems, Ayurveda, Unani, and homeopathic medicine system. And along with that, there is the modern allopathic healthcare system too. Even in the central government health scheme, I being a central government official, I can say that even in the central government healthcare system, they have introduced this Ayush kind of thing, whereas the doctors can refer you to an Ayurvedic patient, Ayurvedic doctor or homeopathic doctor if need be. Secondly, due to the COVID-19 situation, the hospital got overwhelmed either because of patient, or as I in the initial stages pointed out that public healthcare system has to be strengthened both in the east and the west, because many of the cases they can be dealt with at home or maybe in a community health setting, not in the hospital itself. So due to the and someone I think Rutba, which Dr. Rutba had pointed out that from Kashmir that WHO, as per the WHO norms, the doctor to patient ratio in India is already very low. So during the COVID-19, many of the Ayurvedic and the homeopathic doctors, their services were utilized along with some of the retired doctors too, to take care of the patients in the hospital. So anyway, though Ayurvedic access was there to an extent, but some people may have some disbelief about the vaccine. I think even I know some cases where people are not going to have vaccine because they have heard that the vaccine causes this fever, or it will cause tiredness or something like that. And there's also a belief going on that if someone is all right, why to take a vaccine at all? This is not true for the COVID vaccine. This is true for others, such as polio vaccine as well for their children. If there is no disease, why to give him a medicine at all, right? So these kind of things they need to be taken care of. Yes.
Let me also add that people first try the local medicine, but when things go out of hand, then they run to the hospitals. I have a friend's mother who was a big fan of homeopathy. She had breast cancer. She kept going to her homeopathy. Then the homeopathic doctor said, "We can't do anything more. You have to go to allopathy." So the poor first go to these local medicines when things go out of hand. Then they run to the hospitals. Most of the time, people who are, when they're reaching the hospital, their oxygen levels are below 70, below 60. So first is the cheaper option. If the cheaper option doesn't work, then they run to the allopathy. Allopathy is a last option, right? So they're trying out everything, but initially they go for the Ayurvedic and local one because they are comparatively cheaper than allopathy.
Also, to add to the question which was asked, that why hospitals are overburdened. So the thing is that, let's say, for example, a city like Delhi, which is a population of around 20 million people. So currently there are 1 lakh active cases of COVID in Delhi. So in general, we say that around 10% of the population of the infected people have serious issues when they are infected. So out of 1 lakh people, at least 10,000 people are visiting hospital for their treatment. So 10,000 is a big number because there are no such numbers of ICU beds in the city like Delhi. So that's why hospitals, or what you are seeing in the international media, and in which Delhi is in the focus, the thing is that even to cure or to treat 10,000 people is difficult. At the same time, you have other patients, like say pregnant women and other patients which are coming to hospital for their regular treatment, for dialysis, for cancer treatment. So the number gets multiplied. 10,000, you have only COVID serious cases and then other treatment cases as well. And then there is a shortage of manpower, then oxygen and other things. So that's why the situation gets multiplied by several times, and it looks more grim, more sad, and more uncontrolled. So that's the reason why you are reading such articles in the newspaper that hospitals are overburdened.
Yeah, that is very interesting. Can I maybe ask Henry how the situation in South Africa is with respect to traditional medicine and let's phrase it modern medicine? Is that also a problem that people go to the doctors and hospitals too late because they rely on traditional methods?
Let me say like this. I think the government, the strategy the government took in South Africa was quite clever. I mean, I can say I was really impressed because what they did is that they had a national task team, and then each province had also a task team, so that the interventions were being simultaneously relayed in all provinces uniformly. So in other words, they reduced this idea of heterogeneity in applying the non-whatever strategies. So each premier in the province had a task team, and he was listening to the national task team, and they were coordinating the message in a very coordinated. And I think this actually reaped the fruits for that actually strategy, because the information and the education was going simultaneously to the population widely, covering the whole country. So to me, I think that was a big advantage South Africa took, and you can see the impact of the variant actually has not. To me, it is not as what it would have been if that strategy was not there. So in other words, education-wise, I think South Africa did an excellent job. That's what I can say.
Yeah. Okay. Yeah. And maybe just going to Brazil again. Is that an issue in Brazil? That
no,
No?
No. Well, at least I live in the city. São Paulo is a very big place. No, we're not. I understand what the other guys have said. I'm half Indian actually, so I understand this is the home remedy. Not really in Brazil. There is a national health service in Brazil, right? It's kind of like an Obamacare view, a dream. So there is that. So no, people do run to the hospital when they can get there. For me, the biggest problem in Brazil, if I must, well, there are three big problems I think. That's not mentioned in the press. One is that the private sector has been completely ignored, right? In Brazil, completely ignored, right? Like, give you a number, right? The Brazilian government spends 25 billion US dollars, right? 25 billion on their national health service, right? Okay? For 210 million Brazilians. The private sector spends 44% more, right? Which is 36 billion for only 25% of the population. Only 25% of the population have access, well, can afford, to be honest, private healthcare in Brazil, right? So 50 million, 53 million, more or less, right? And that amount of persons there, that amount, the 52 million people, get spent 44% more than the entire country the government gives. Okay, so that's the number. And in Sao Paulo, the private healthcare is very good. You can get an MRI 24 hours, 7 days a week. Okay, is a place very close to my house, right? But the government has specifically said no, it's elitism. We can't get the private sector involved. So that's that. Okay, so for me, that has been a huge issue. Okay, I'm like 56. I'll take another 3 months to get vaccinated at this point, at this rate that the government. This is a good estimate, right? 3 months more, that's a good estimate. So anyway, the other big problem, of course, is there's a Brazilian version of the FDA in Brazil called Anvisa, and they spend a long time to approve drugs, right? And even Bolsonaro, who people don't like, of course, he had to say, I'm giving you 7 days to approve Pfizer, right? So even like the mighty Pfizer, they had to jump through hoops. They had to give documents for Brazil to stamp and said, okay, we can. And in the end, they only did it as an emergency measure. They didn't even give poor Pfizer or Johnson & Johnson, those guys, the full blessings. They said a reluctant, okay, you can come and vaccine these people if you want. They just told Sputnik, they went to Russia and looked at Sputnik and said, they told Russia, no, this is irresponsible. We cannot give this to Brazilians, you know? So smoking is okay, but no Sputnik viruses. So, I mean, that's not helping, you know? That the private sector isn't involved. And that's a big backbone of Brazilian healthcare. It is what it is. And as I said, this company called Anvisa, whilst they should be looking at Brazilian patents or Brazilian drug inventions, that's fine, right? But these are drugs approved by other large developed countries. But no, they have to jump through hoops, and they haven't stopped doing that. Another big thing, in my opinion, that's going to blow up is poor education for the vaccinated. We have vaccinated 30 million people. And I know, of course, no people have been vaccinated. And they are given no guidelines, to be honest. A suggestion maybe to check for IgGs in like a month's time. The fact that RT is going to drop, but not 100%. So, masking up still important. No education whatsoever. So unfortunately, I do fear a third wave, because the vaccinated, the ones fortunate enough, are going to go willy-nilly and are going to enjoy themselves. And it's not going to come to a good end, in my opinion.
So there are similar problems in Brazil compared to India and Africa, but it's not maybe a competition between traditional medicine and modern medicine. It's more that people believe or don't know what to believe because they are not knowing the scientific background of vaccination and immunity response and things like that.
Correct. That's right. So, but from a cultural point of view, it's quite different as well. Brazilians want to be vaccinated. Okay. For instance, give an example. Nice example here. The government has certainly said there are priority people, the elderly, of course, let's say, and then they've decided the policemen or teachers are a priority. The truck drivers went on threatened a national strike if they are not a priority group, right? So once you start inventing a priority, everybody thinks they're a priority. I think I'm a priority. I'm paying life insurance claims and health insurance claims, but I'm not. Anyway, so now you have people striking or threatening to strike. Bus truck drivers are important, of course, in Brazil. So I don't know where this is going to end. So at least there's one thing in Brazil. There was some surveys.
That is quite interesting what you say, because usually the discussion is only about enhancing the acceptance of vaccinations. But now, of course, it could also be turned around, as you say, that certain groups want to get vaccinated earlier and go into strike and things like that.
Yes. So I've seen lots of surveys, you never know who to believe, but Brazil is always at the top of vaccination. They want to be vaccinated, as always at the very top, normally at the top, right? Now, and also the thing is that there was some good news. Thankfully, somebody had the wisdom to cancel the carnival, right? So the carnival was going to be end of February, which is a big mass, big party for 5 days. That was cancelled all over Brazil and more or less adhered to, right? So that was good. That was some wisdom at least. And finally, São Paulo, the largest city in Latin America, is very digital. You can get anything delivered to your home, right? 24 hours a day, anything literally. So if you really want to stay, and socially isolated, distance, at least it's possible, right? So I know in certain countries that's not going to happen, but in Brazil, fortunately, that if you go to the street, you're really looking for trouble. So anyway, so that's my point of view.
Okay, well, thank you. So I think I would, because you're running out of time, I would like to skip the multi-factor analysis now and would like to go right away to close the session to lessons for the future. So what can we learn from the current Indian crisis? What should we do different? I mean, I think we have touched a lot of these points already during the discussion, but maybe let's try to get some kind of summary. So we have addressed all the problems, but now I would like to know more from you. What would be strategies to overcome the problems? I'm not thinking at the moment of more deliveries of oxygen to India. This is, of course, clear that the world has to do that now, just to save lives immediately. But what can we learn from India on a longer term? What should we avoid? What should we encourage? What would be your opinion about that? So I would just like to go around and ask each one for a final statement on these issues. So let me do this relatively systematically. So let's maybe go to Andy, go back to Andy, because he is on top of my list. Sorry for that, Andy.
I mean, it might sound arrogant, but I think it's pragmatic. I think the simplest thing you say is listen to the scientists. And there are some scientists that are going to be wrong, but I think one thing that's been very strong in the UK is, that's one of the cutting edge places for people doing epidemiological modeling. And there is a group that meets with the Prime Minister and members of the cabinet to give scientific advice. It's not always followed. And that straight away gives this warning that the politicians will distort the science. And the worst possible examples have been the US, Brazil, and then possibly also India. So you have to have a credible scientific advisory board and set up something within government that does this for any of the existentialist future crises we're going to deal with. And the public just have to have confidence in those scientists and know that there will be people who try and undermine that advice. But the only credibility you have as a scientist is by being consistently correct. And that's completely different from the credibility you have as a politician.
Yeah, well, I absolutely support what you said. That was a very nice summary. Thank you, Andy. Maybe I go now to Henry.
Right, sorry, yes. I'll just pick up from Andy and just say that I think we need to have a credible task team, which includes a scientific advisory team within it, and have a coordinated messaging over all the states in India. In other words, we need to have very coordinated messaging such that there's no mix up of kind of information being transmitted, so that people can be educated about this problem thoroughly, so that if it is any whatever they're supposed to take, action they're supposed to take, they take it uniformly and homogeneously across the country. I know it is a big country, over 1 billion people, but I think now that is actually the challenge. So that's why we need a very, very efficient task team to tackle the problem. Thank you.
Yeah, thank you. That is also a very good summary. So yeah, actually, let's go back to Ronald for a moment. Would you like to say something about?
I'll be brief. Of course, I agree with Andy with the science, but to be honest, it's still on very shaky ground. So just basically, social distance, wash your hands, wear your mask, just do it, because we're still very shaky. And who would have thought India would have blown up? Who would have thought New York would have blown up, right? I would never have seen that. And we should say predictive modeling isn't working from this point of view, right? So
Yeah.
really the best you can do is, as I said, what the Spanish flu side sort of like measures, until we really have a grasp for it. We really don't know why London blew up at some point, etc., etc. So, but you have to keep ramming home the education. So that's it. Thank you.
Well, thanks. I mean, that was an answer also to my heart, because I also think the predictive modeling is not yet there. It should have performed better. I agree with that as a kind of self criticism. So yeah, now I would like to go to my Indian colleagues. I think they should have the last words on this. Yeah, so choose, maybe go to Krishna first.
My final statement would be that I think it is a political failure, not a failure of science. And it also has brought out the inherent authoritarian nature of our governments. I believe not just in India, even in Europe and everywhere. The deep distrust for democracy, the deep distrust for, and imposing things from above. This has been, and particularly the effects on the poor or disadvantages much more. So I see, as a student, of course, I'm a political scientist, so I see more as a political failure, not a failure of science. And there has been an intellectual enterprise in the last 20 years in India questioning Western modernity, science, even Western medicine, and this has percolated slowly into middle classes. So now questioning science or being skeptical is legitimized through intellectual effort. You must be knowing Foucault, and all these things have come down. So this has made people confused to really trust science. This science is seen more as an ideology rather than as something this thing. So,
but do you think the pandemic can bend that backwards a little bit, at least?
It works because the distrust for hospitals, they're only going as a last resort, right? Science is only a kind of a tool, instrumental, but not the belief in the science.
Yeah,
they're just trying out. Maybe this works. They're just trying out, not with the belief in the science or the belief in the credibility of the doctor.
So that belief needs to be restored.
Yeah, that has been under attack in our country since independence, seriously. And also everything coming from the West is, science is seen as Western. And so therefore there is an ideological issue of trying to promote Indian medicine, and therefore it's seen as an ideological fight. It's not simply the efficacy of the medicine. So therefore there is ideology from my point of view as well.
Yeah.
That's my last statement. Of course, all other issues of class, privatization, only the rich people who are given, you have good hospitals, so you don't need to worry. So the public sector was ignored because that went to the poor, right? So the public infrastructure was ignored, and private, so the middle classes, the rich relied on this. But now it's failing. The private sector is also failing in India to provide beds. And plus there's black marketing and economical thinking. Yeah, that's my final statement.
Thank you. Let's go to Vikas, who want to say something?
So, so far, I believe the only way forward for India and for other countries is to vaccinate as many people as possible and as early as possible. Also, we have to make sure that vaccines are being priced quite highly. So, civil society's role is quite important. We cannot always rely on the government to provide things for cheaper, like price or for free. So we should make sure that we take out the people, or we should bear the cost of the people who are not eligible to pay for their vaccine cost, and at least crowdfund or do something at the social level to make sure that everyone is vaccinated.
Yeah.
India has a quite robust system to vaccinate people, and our vaccination plan is going quite as per the set directives. Some states are doing good, some states are lagging behind. I hope they will pick up soon. And also, as far as the production capacity of the vaccine is concerned, we are, I guess, producing around 24 crore vaccines from upcoming month, so which would be a good number. So I guess we would be able to vaccinate many people soon. So yeah, I believe vaccination and coming together of civil society to make sure that each one of us get vaccinated on time and within a particular period, rather than taking it for like next 2-3 years. So that would be the easiest way out from this crisis.
Well,
and of course, as Ronald said, that we should keep up our mask and keep up washing our hands. Those are the
well, what you say is excellent, and I fully support that. But there is this specific problem that, of course, the developed countries will now get their populations vaccinated first. That is, I think, unavoidable. Do you think we will get to a more equal distribution of vaccines towards the end of the year? Are you hopeful for that?
Once India is out of this crisis, I can make sure, like I can argue for now that India would be able to lead this whole idea of vaccinating the underprivileged and providing vaccines for free to the countries who are not able to pay for it or develop on their own. I'm really sorry for the countries which are causing this trouble with their vaccine nationalism, especially USA. It's a disappointing thing to see that they are not allowing their hoarded vaccines to go out to the people who actually need it. So I think we need to convince such country that they should be more humble, more open-minded towards reaching out to the underprivileged country and those who have been traditionally discriminated. So I'm hopeful. Once India is out of this situation, I hope the government is ramping up the vaccine production, scaling up the production techniques. So India would in itself would be sufficient after vaccinating its population to reach out to the marginalized country and the developing nations to support their vaccination program. I'm quite hopeful within next 1 year. I think we would be discussing there was something called COVID in 2019 and 2020.
That's a very good conclusion. I like that. Thank you. That was great. Rutba, would you like to say something?
Yeah, I'd actually like to make 3 points. First, being vaccinated, which Vikas already, I think he explained most of it. So India has just begun to decentralize the vaccination from central government to state governments. And now state governments are rolling out the vaccines for their population. But we do need to lower the prices of the vaccines available to people. And I think Manisha Bhatnagar just said that the government is on it to lower the prices so that it is accessible to the masses. It needs to be accessible to the masses. And the second is, I wouldn't really rule out predictive modeling so early. If India had closely followed what was happening in Britain, maybe it wouldn't have come to this. So even after the vaccination drive, I think India needs to follow how Israelis are being modeled, the vaccinated Israeli population, which are out in public and enjoying all the things that we would usually do pre-corona. So yeah, I think we don't need to roll out predictive modeling so early. It is very necessary to keep up with the things that are going around us, because I think Ronald also pointed out that there could be a third wave in Brazil itself. So following up Brazil, following up Israel, following up UK, following up the United Kingdom and the USA, because USA just put out that the Americans are no longer required to mask up as such. But in India, and I think it is still very, very important that we all get vaccinated at the earliest possible within the time span that we are given, and we follow the basic SOPs. And most of all, it is a governance failure rather than a scientific failure. If the rest of the world has been able to get over it somehow, then why not this part of the world? So it does fall. So yeah, the lagging is on the government. They have been authoritarian. They have been ignorant and arrogant about it. I think the government needs to pull up its socks, and for the rest of us, all we can do is really just follow the SOPs. So yeah, that's about it.
Thank you. That was also a good statement. Manisha, do you want to say something? That seems not to be the case. Okay, then.
Okay, can you hear?
Oh yeah, now I hear you. Yeah.
Okay. Oh, sorry. Yeah, actually, I am P.S. Bhatnagar attending the seminar from my wife's ID because my ID had some login issues. So I would like, Ritva, I would also like to make 3 points. First point is that in COVID-19 or any other pandemic or epidemic, we need to flatten 2 curves: infection curve and the economic curve. Merely flattening the infection curve is not enough. One thing. Second thing is that both scientists and politicians, so far as my experience goes with the politicians as head of office in the western part of the India, of a central government organization, both scientists and politicians need to understand each other better. Merely criticizing politicians is not enough, or merely criticizing scientists is not enough. They both need to understand each other and need to come up together for the benefit of society at large. This is one thing. Then thirdly, COVID-19 is something which science alone cannot resolve. Hospitals or vaccines or medicine, even if you vaccinate 100% population, this is not going to solve the problem because virus keeps on mutating and the old vaccine may get defunct against the new variants against of the COVID-19, or it is or the so far as whatever vaccines we have, their long-term effects are not known so far. So managers, lawmakers, and economists, sociologists, policymakers, administrators, law enforcers, likewise people from artists, different people of different discipline have to come together. In Canada, they have taken help of musicians to promote awareness among people about maintaining social distance, about being at home, about being isolation or quarantine, and so on. So science alone cannot solve this. We have supply chain issues, we have raw material issues, we have many other issues. So even the marketing people help may be very, very helpful, or management people help may be very, very helpful. They have a role to play in. Even educationists have a role to play in. So I don't think science alone can solve this problem. So I make this. So I conclude my chance to speak in this seminar by these 3 sentences.
Well, then I would now come to the conclusion. So I would like to thank for all contributions. It was really very interesting. Also the comparison between different regions of the world. Of course, we focus today on India specifically. But I think also it was a very nice discussion, at least I thought so, between the scientific approach to the problems and what kind of resistance to this scientific approach you have in different countries, and especially in India, as we discussed today. So I think also from the scientific side, we need to improve our communication. We need to be open about our results. We must talk about how reliable our modeling and data analysis is, etc. Because otherwise, if we make mistakes and make wrong predictions, that can only that will not give people a lot of trust in science. I think also what has been said about the interaction between politics and science is very important. I also share the belief that the interaction between science and politics. So how how scientists do actually give advice to governments, for example, this surely can be improved in future, and we can learn a lot about this in the current coronavirus crisis. Okay, so with this, I would like to end. Thank everybody again. And I hope for India that the crisis will be managed in the best way and that we find some signs of hope very soon.
Thank you.
Bye.
Bye.
Cheers. Bye-bye. Thanks a lot, guys.